sharing 1,435 kilometers land border with China, with a population of 96 millions. This is a story of how Vietnam has been successfully fighting COVID-19 and limiting the number of deaths at zero. Vietnam's success is based on these key factors: experience and preparation, aggressive contact tracing, quarantine and localization, cooperation from both people to government. Vietnam was the first country to contain such epidemic in 2003 with the brilliant work of the Ministry of Health, Nguyễn Thị Kim Tiến at the time. A system prepared for fighting infectious and viral disease was developed, as they had later gained more experience in fighting several diseases such as H1N1 2009, MERS, H5N1. This system has shown its efficiencies and was a key factor to prepare for what about to come. The first confirmed case of the novel coronavirus in Wuhan, China, was reported on December 31, 2019. It was the busiest time of the year when people started to come back to the country celebrating Lunar New Year. Activities of shopping, transporting was chaotic. People were informed about the new SARS-like virus on media. There was concern and debate, but to the government, this was a warning. They came up with 5 scripts for 5 levels of potential scenario, and to each scenario, they had already scripted necessary guidance for department and local authorities how to react immediately. The biggest concern was if the disease broke out in Lunar New Year. On January 21 of 2020, the first patient was confirmed. Vietnam started to stop all flights came from Wuhan, limited border trading and stopped visa at arrival for people came back from Wuhan. New cases pop up in North Vietnam for workers who had already came back. The process of aggressive contact tracings and quarantine started. Here is how it works. The confirmed case is labeled F0. All the person interacted with F0 in the past 14 days is labeled F1. All the person interacted with F1 in the past 14 days is labeled F2, and so on to F3 and F4. This process can involve hundreds of people. If you live in Vietnam during February to April, you might see a list like this. This is the list of all F4 sent to local authority to start contact tracing and testing. If all the F3 and F4 is negative, means they have successfully localized the spread of the virus and stopped community spread. This is for the medical system can both focus on developing their own testing kit and taking care of those in need. The government also addressed that others who came back from Hubei, they prepare flights to rescue citizens to come back because Wuhan was at the state of lockdown since January. At home, hospitals and military bases are already prepared for the process of quarantine. Later, this process expands for people came back from Daegu, Korea, and Japan as new disease clusters emerge. The patients are isolated at the hospital for medical support, and all the others are quarantined at military base with daily checkup and supplied with free necessities like food, drink, personal items, internet. The quarantine process is obligated, and even if your result came back negative, you still have to finish the 14-day process. This is to prevent all early cases cannot be detected by testing. If anyone in the areas is confirmed to be positive, process will start all over again and continue for the next 14 days. On February 12, a whole village of Sơn Lôi with over 10,000 people was at the state of lockdown when there was only 11 confirmed cases. The people and government considered lockdown was necessary to stop further community spread. People was informed every day through direct messages, media and television, keeping the public from worry and overreact, and informed them over what mask to wear and how to get sanitized to prevent the virus. But people started to stock up masks and sanitizing products for the cause of prevention. The market police have to join to keep the supply chain stable. Factories also started to mass produce medical supply to prevent shortage. With all cooperation from the general public, Vietnam successfully contained the cases as 16 and all recovered. From February 25 to March 6, there was no confirmed new case until case number 17 on March 6. Phase 2 was executed. Case number 17 came back from England on the flight VN0054. She hit her travel route to Italy so she didn't have to be quarantined. She has started to show symptoms of body ache but did not show fever at the airport, so she was able to come home. She later came back home sick and isolated at home until she came to a private hospital and confirmed to be positive. The hospital staffs at the ship were quarantined. Number 17 had infected her aunt and driver on the way home. This was an alert. The new heart of disease is the Europe, and people might have already slipped through quarantine. They began to trace down all passengers on flight VN54, chasing all those has interacted with them, and encouraged Vietnamese citizens who came back from the Schengen area, England and North Ireland, informed the government to be quarantined. Also on the same day of March 6, Vietnam announced to be one of the first countries successfully developed and ready to mass-produce their own real-time RT-PCR and RT-PCR testing kit for COVID-19. With the campaign of Vietnam Leaves No One Behind, the government provides all free 14-day quarantine and free treatment for all Vietnamese. Overseas Vietnamese started to come back to the country. Airports are flooded with thousands of people each day. Staffs have to work all day to provide quarantine places for people. Military school, college dormitories turn into quarantine area. People might be exhausted, but they were glad to come back. Even though the number of cases rise high in number, it never reached 20 new cases a day, and 62% of them was people came back from other countries and have already in quarantine. The WHO declared COVID-19 a pandemic. No one in Vietnam is surprised, as they have already focused all sides following this disease in Vietnam every day. Most schools has been closed for 3 months, and doctors in front line haven't been able to come home for months. But despite the effort of everyone, the system was starting to overload. The government went to decide to stop all flights from Europe and ban visa arrival for all countries on March 17. Closed border with China, Laos and Cambodia. The number of patients went over 100 and community spread were foresighted. Even though many cases can be traced back to F0, the contact tracing process was hard to conduct when people avoided and did not cooperate with the authority about the information. On March 29, the head hospital of Vietnam, Bạch Mai Hospital, was put into quarantine for 14 days as several staffs on food supply of the hospital was infected, but they lost track of F0. The cases were at 194. They started to quarantine and tracing people who had came to Bạch Mai Hospital in March and informed them to report health information. All the F were tested and the quick test kits from Korea for faster localization. On April 1st, the countries were put into social distancing, but not just normal social distancing. All business now closed except food and basic supply. They ban over 20 people gathering, and wearing masks in public is made mandatory. If you don't wear masks in public or going out for unnecessary purpose, you might have to pay a penalty. There was no lockdown policy, but people set up their own stop, registering information and temperature checking all people going in and out the neighborhood. Effort resulted in significant drop of cases. The patients also recovered with large number. There was no new confirmed case inside community, only 2 cases confirmed in quarantine zone. 3 weeks social distancing was successful, and now the government is step by step opening the domestic economy. People come back to work and students gradually go to school, but keep distance at least 1.5 meters and all have to wear masks. The successful in containing efforts spare time for medical system not overloaded with patients. All of them was taken care of carefully every day by the top doctors of the country fighting COVID-19 in the front line. Through the entire timeline of the disease up to April 29, Vietnam has tested over 200,000 individuals. Most of them are real-time RT-PCR and RT-PCR tests. All 10 positive results from Korea quick test came back negative when executed by PCR test. After being discharged from hospital, all the recovered cases will continue a 14-day process of quarantine and medical checkup in local hospital to make sure they don't get reinfected. This is why all people in quarantine are tested twice since arrival and leaving to make sure they are perfectly healthy. The COVID fight is also on media aspect. Fighting fake news and false propaganda is important so as people won't burn down 5G towers or drinking disinfectant. As of March 15, 654 people was penalized for spreading fake news in Facebook and raised concern in society. As of cases number 17, before she was confirmed, the entire neighborhood had noticed the appearance of doctors and police. They have already suspected new cases before the government confirmed new cases 1 hour later. Vietnamese live in a close-knit community. Your activity can always catch the attention of neighbors, with 40% of the general public using internet, especially Facebook. It's necessary for the government to keep data transparencies and open to the public. In fact, each case is tested at least twice to confirm status. If they are infected, data will immediately sent to the WHO. Whichever route interaction will also be informed to the public. Since early of the disease, the government has built apps, websites, Facebook's page dedicated solely on informing people about the virus, reporting health status and hotline for immediate medical support concerning COVID-19. Here in this website of the Ministry of Health, you can discover what update about patients, what the authority have done and considering doing next. All the infographic of the world, Vietnam about patients, contact tracings, infected information. To build this type of interactive graphic required both data transparencies and accuracies. The government is really serious about what they are doing. In the middle of pandemic, people show support for the government and support others. People in quarantine areas receive free supplies from outside. Through texting campaign, private business and banks, the general public has supported the government's nearly $43 million worth of money and medical supplies, helping the country fight COVID-19. The government spent approximately $2.6 billion, equivalent to 1% of the country's total gross domestic products, to help about 20 million individuals who is poor affected by the pandemic. They will receive about 1/3 of the basic income. Not big, but in the middle of pandemic, this is more than just emotional support. In Vietnam, you can see people handing out masks, rice ATM and $0 supermarkets with bills, so the one in need can take what they need to get through this pandemic together. Since Vietnam is totally independent of their testing kit and medical supply, they were able to support other countries with medical aid, mask, testing kit. On April 21, Vietnam real-time RT-PCR testing kit was approved by England with CE standard, so it can be freely traded in Europe. Being a country can mass-produce medical face masks, Vietnam has supported many countries like India, Sweden, USA, Japan, Russia, UK, Germany, France, Spain, Italy. Vietnam supported Laos and Cambodia with medical supply to help fight COVID-19. The domestic economy in Vietnam step by step is coming back, waiting for the outside world to ease and open. They have come further to successfully develop their own quick test kit and was able to produce their own medical ventilators. Despite the pandemic, the first 3 months of the year, the economy is still able to grow 3.5%. A miracle? No. As a quote from a dear friend who stayed and update at North Vietnam quarantine facility.
I said what I said, that while the rest of the world has waited, Vietnam has been preparing.
Thay mặt Ban Chỉ đạo Quốc gia, tôi xin trân trọng cảm ơn nhân dân đã đồng sức, đồng lòng, chung tay chống dịch. Dù phải chịu rất nhiều bất tiện, thậm chí là thiệt thòi về lợi ích kinh tế. Và hơn thế nữa, rất nhiều tổ chức, doanh nghiệp, cá nhân, từ các cụ già đến các em bé, đã có vô vàn những hành động rất đẹp và hết sức ý nghĩa để tiếp thêm sức mạnh cả về vật chất và tinh thần cho cuộc chiến chống dịch. Tình hình dịch bệnh vẫn còn rất phức tạp và phía trước chúng ta vẫn còn tiềm ẩn không ít rủi ro và nguy cơ. Cho nên chúng ta tuyệt đối không thể chủ quan, không thể lơi lỏng. Nhưng nếu toàn dân đồng lòng, toàn dân chống dịch thì nhất định chúng ta sẽ chiến thắng.